Do you know what restrictive cardiomyopathy is? It's a term you might not hear every day, but it's an important one. Restrictive cardiomyopathy, or RCM for short, is a rare heart condition where the muscles in the heart's lower chambers, the ventricles, become stiff. This rigidity hampers the heart's ability to expand and fill with blood, which in turn reduces the amount of blood the heart can pump to the rest of the body. Over time, this can potentially lead to heart failure, a serious condition where the heart can't pump enough blood to meet the body's needs. This isn't a common condition, mind you. It's actually the rarest type of cardiomyopathy, affecting about 5% of all cardiomyopathy cases. So there you have it. A brief introduction to the world of restrictive cardiomyopathy. So, how does a doctor identify this condition? The answer lies in a combination of careful observation and specialized tests. When restrictive cardiomyopathy is suspected, the first step is usually a thorough physical examination by a healthcare provider. They might look for signs like swelling in the legs or neck veins, which can indicate heart trouble. But physical signs alone are not enough. To make a definitive diagnosis, doctors often turn to advanced imaging techniques. One of the most common is an echocardiogram, a test that uses sound waves to create a detailed picture of the heart in action. It can reveal whether the heart's lower chambers, the ventricles, have become stiff and rigid, the hallmark of restrictive cardiomyopathy. Sometimes additional tests may be needed. These could include a stress test, where the heart's response to exercise is monitored, or a cardiac MRI, which provides an even more detailed view of the heart structure and function. Remember, early diagnosis is key as it allows for better management of the condition. So, if you or a loved one are experiencing symptoms that concern you, don't hesitate to reach out to a healthcare provider. Your heart will thank you. But what does this condition feel like? What are the signs and symptoms? When it comes to restrictive cardiomyopathy, the symptoms can be varied and they often resemble those of heart failure. Individuals might experience fatigue and weakness, which can significantly impact their daily activities. There can be a feeling of breathlessness, especially during physical exertion or even while at rest. Some might notice swelling in the legs, ankles and feet, a condition known as edema. This is due to the heart's inability to pump blood efficiently, causing fluid to build up in the body. Rapid or irregular heartbeats, also known as arrhythmias, can also be a sign of this condition. In some cases, individuals may experience fainting spells or dizziness, and in more severe cases, there can be abdominal pain or a loss of appetite caused by an enlarged liver or fluid buildup in the abdomen. It's important to remember that these symptoms can also be caused by other conditions. So it's crucial to consult with a healthcare provider if you're experiencing any of these signs. Recognizing these symptoms early on can lead to a timely diagnosis. Let's delve into some facts and figures about restrictive cardiomyopathy. This heart condition is quite rare, representing only about 5% of all cardiomyopathy cases. It doesn't discriminate between genders, affecting both males and females equally. The incidence rate isn't exactly clear due to its rarity, but it's known to occur more often in older adults. This disease is not just a medical condition, it's a life-altering experience that impacts every facet of a patient's life. While it's a rare condition, it's important to be aware of it. Now, let's talk about survival and management of this condition. The prognosis of restrictive cardiomyopathy can vary greatly. Hence, it's crucial to follow healthcare provider recommendations. Lifestyle changes, such as a heart-healthy diet and regular exercise, can help manage the condition. Medication is often used to manage symptoms and underlying causes. In more severe cases, a heart transplant surgery may be considered. Remember, with proper management, people with restrictive cardiomyopathy can lead fulfilling lives. Restrictive cardiomyopathy is a complex condition, but understanding it is not. As we've learned, it's a heart disease where the lower chambers become rigid, affecting the flow of blood. Diagnosis involves physical exams and tests like echocardiograms. Its symptoms vary and can resemble those of heart failure. Despite being rare, affecting only about 5% of all cardiomyopathy cases, it's crucial to be aware of it. Management revolves around treating underlying causes and symptoms, and in severe cases, may require a heart transplant. Remember, knowledge is the first step towards a healthy heart. Stay informed, stay healthy. Like, share, comment, and subscribe